So we have a defect after Mohs surgery in the forehead. It's on the left forehead in the superior aspect, and as you can see, it's pretty large. And we have to now reconstruct it. It was from basal cell carcinoma excision. And forehead can be challenging sometimes in some patients because there's not a lot of mobility. I mean, down there is in the lateral aspect, but right around here, there's not a lot of mobility. I mean, it doesn't move too much. And we have different options we can use. The option that works the best actually is the primary closure, by putting it together, making it a long line going from here all the way to here, because that'll compensate very nice, and eventually it's kind of like blend in as a horizontal line. That's what it's going to do. Some people like to do like O to Z flap and all that stuff, but you know, the zigzag scarring might not look good, and I don't like that. Instead, I'm going to do just a straight cutting here, and we'll show you as we do it at the time of surgery and afterwards. And initially, you know, there's definitely a lot of deformity. The left eyebrow goes higher, but with time it settles down where only the patient notices, nobody else notices. And that's what we are going to do. But the critical thing is the proper marking and having it horizontal.